This presentation is in regards to sudden infant death syndrome. We'll be referring to it as SIDS. My name is Dina Westermeyer. I'm with the University of Arizona Global Campus. It's for Class 7510, Biological Basis of Behavior, Dr. Trednick, and it's due October 12th. Sudden infant death syndrome, or SIDS, remains a significant contributor to infant mortality globally, influenced by a variety of genetic, neurological, metabolic, and environmental factors. In the United States, approximately 3,700 families are impacted by the syndrome each year, leaving them grappling with grief and unanswered questions surrounding their baby's passing. Despite being one of the primary causes of infant mortality, the exact causes of SIDS are not still fully understood. Research by Frelinger and Associates, Goldwater, and Avery have shed lights on the role of serotonin system dysfunction, genetic predispositions to bacterial infections, and viral triggers in disrupting infants' vital arousal response during sleep, rendering them susceptible to fatal outcomes. These findings underscore the significance of comprehending both inherent biological factors and external stressors such as prone sleeping and exposure to cigarette smoke, which further heighten the risk of SIDS. Studies by Bell and Fraga have identified risk factors and highlighted the effectiveness of education-based outreach programs in reducing SIDS cases. These initiatives prioritize training healthcare workers, social service providers, and parents in safe sleep practices and identifying modifiable risk factors. By arming communities with knowledge and support, these outreach programs aim to prevent SIDS by addressing both the environmental and behavioral factors contributing to infant vulnerability. Together, these studies emphasize the necessity of adopting a comprehensive, multifaceted approach to SIDS prevention. The triple risk hypothesis of SIDS is that three factors must coincide for SIDS to occur: biological vulnerability, a critical developmental period, and exposure to external stressors. Frelinger and Associates have focused on the biological vulnerabilities associated with serotonin system dysfunction in the brainstem, which is crucial in regulating breathing and arousal during sleep. In infants with this dysfunction, their ability to wake up or respond to life-threatening situations such as low oxygen level or increased carbon dioxide during sleep is impaired. This inability to arouse from sleep in response to respiratory distress is a crucial failure in the behavioral response that are necessary for survival during the critical developmental period of early infancy, making these infants more susceptible to SIDS. Goldwater expands on the model by incorporating the role of bacterial infections and genetic predispositions. Infants with genetic vulnerabilities to bacterial toxins, such as those produced by Staphylococcus aureus, are at higher risk of SIDS. Those toxins can impair neurobiological and behavioral responses during sleep, particularly when combined with environmental stressors like prone sleeping. Avery and Associates further contribute to this understanding by highlighting the impact of viral infections, such as rhinovirus, which can exacerbate these vulnerabilities. In their case study, rhinovirus infections was detected in both the respiratory and central nervous system of an infant who died of SIDS, suggesting that even mild viral infections can disrupt respiratory control mechanisms in infants with underlying vulnerabilities. These findings collectively reinforce the idea that SIDS occurs when biological vulnerabilities, developmental immaturity, and environmental or infectious stressors intersect, making the triple risk model a comprehensive framework for understanding SIDS. The research conducted by Habish and colleagues in 2024 highlights the importance of gestational age in cases of SIDS. The study shows that preterm infants have different patterns of death timing compared to full-term infants. Their findings reveal a negative correlation between gestational age and the timing of SIDS-related deaths, indicating that despite facing higher overall risk, preterm infants tend to die later than full-term infants. This suggests that developmental vulnerabilities related to gestation may influence an infant's risk profile for SIDS, as preterm infants might experience delayed critical periods for respiratory and cardiovascular control and maturation. Additionally, the study notes that SIDS mortality peaks during the third month of life, regardless of gestational age, supporting the theory of critical developmental window, during which infants are most vulnerable to fatal outcomes. Habish and Associates suggests that the combination of prematurity and environmental stressors, such as unsafe sleep environments, may exacerbate the risk during this period. These findings underscore the importance of understanding the developmental trajectories of infants born preterm, as they may require extended monitoring and targeted intervention to prevent SIDS. Brainstem dysfunction is a critical factor in the developmental of SIDS, primarily due to its role in regulating the autonomic nervous system. The brainstem is responsible for functions such as breathing, heart rate, and arousal from sleep, and can experience abnormalities that compromise these essential processes. Frail, Martinez, and Collings emphasize that disruptions in the brainstem, particularly in the areas like the pre-Botzinger complex, can interfere with an infant's ability to regulate breathing and heart rate autonomously. This dysfunction leads to a lack of control over respiratory and cardiovascular functions, which can be life-threatening, especially during stressful periods, such as when an infant is sleeping face down or exposed to environmental stressors like overheating. The immaturity of these autonomic processes, combined with other risk factors, make infants particularly susceptible to SIDS during the first few months of life. Expanding on this understanding, Frelinger and Associates underscore the significance of serotonin system within the brainstem, which is crucial for regulating arousal from sleep. In cases of SIDS, abnormalities in serotonin pathways hinder the brainstem's ability to prompt appropriate arousal responses when an infant experiences breathing difficulties or other stressors during sleep. This impaired arousal response prevents the infant from waking up or grasping for air, a necessary protective mechanism. The malfunction of the system, in conjunction with the compromised autonomic control described by Frail, Martinez, and Collings, further elucidates why many infants cannot survive prolonged episodes of respiratory distress during sleep. Understanding brainstem dysfunction, particularly in the autonomic nervous system and serotonin pathways, is crucial for comprehending SIDS. Frail, Martinez. Serotonin, as mentioned before, serotonin plays a crucial role in regulating various physiological functions such as breathing, heart rate, and the ability to wake up from sleep, all of which are essential for an individual's survival during sleep. A study by Frelinger has emphasized a connection between abnormalities in the brainstem serotonin system and SIDS. In healthy infants, serotonin acts as a neuromodulator in the brainstem, helping to initiate wakefulness when the infant experiences disruptions like oxygen deprivation or elevated carbon dioxide levels. However, in cases of SIDS, the serotonin system may be dysfunctional, leading to a failure in the brainstem's ability to activate these protective wakefulness mechanisms. The study by Frelling and colleagues revealed elevated levels of serotonin in 82% of the SIDS cases they examined, suggesting that an excess of serotonin may impair the proper functioning of receptors necessary for wakefulness. This dysfunction in the serotonin system results in what researchers describe as deficit in wakefulness. Frelinger and Associates found that in many SIDS cases, abnormalities in serotonin receptor function with the brainstem compromise the infant's ability to wake up or exhibit stress responses such as gasping for air when faced with respiratory challenges. Their study demonstrates that 78% of SIDS cases show significant reduction in serotonin receptor density in critical areas of the brainstem. The inability to wake from sleep when experiencing breathing difficulties is a critical failure that may explain why these infants succumb to SIDS during sleep without the proper activation of serotonin pathways. These infants cannot respond adequately to life-threatening situations, making serotonin dysfunction a critical factor in understanding the mechanism behind SIDS. The proper functioning of the autonomic nervous system is crucial for regulating essential physiological behaviors, such as breathing and heart rate, especially during infant sleep. In their 2024 study, Frail, Martinez, and Associates emphasize the autonomic nervous role in maintaining internal balance by controlling involuntary functions like respiration and cardiovascular activity. As observed in SIDS, disruption in the autonomic nervous system results in the infant's inability to respond to life-threatening situations, such as decreased oxygen level or increased carbon dioxide levels during sleep. The study reveals that compromised autonomic nervous systems regulation hinders necessary responses such as elevated heart rate or rapid breathing, vital for sustaining oxygen levels and preventing asphyxiation. Autonomic nervous system dysfunction impacts the infant's ability to exhibit essential behavior responses to physiological stress, such as waking up or gasping for air. Frail, Martinez, and Associates clarify that when the brainstem responsible for regulating the autonomic nervous system malfunctions, it fails to activate arousal mechanisms when the infant's breathing is compromised. This is particularly perilous during sleep when the body needs to correct breathing irregularities. Without the autonomic signals to awaken or grasp for air, the infant remains in the state of respiratory distress, ultimately leading to fatal consequences in some SIDS cases. Kew and colleagues found that immaturity of nervous systems in infants significantly impacts critical behavior responses during sleep, such as crying or movement, when faced with environmental stressors. The research examines infants who experience SIDS and discovered that younger infants, particularly those under 20 weeks of age, exhibited higher thymus weights and elevated creatine levels compared to healthy controls. The increased thymus weight, which indicates the size of the thymus gland responsible for immune system development, was notably prevalent in SIDS cases, suggesting an exaggerated immune response that may contribute to compromised physiological and behavioral reactions. This immaturity in the developmental of nervous system, especially in very young infants, likely hinders their ability to respond appropriately to stressors, such as changes in oxygen level, overheating during sleep. The study also revealed elevated levels of pro-inflammatory creatine such as IL-1B and IL-6 in the thymus in infants who succumb to SIDS. These heightened creatine levels further suggest that the immaturity immune system reacts to subclinical infections or other stressors, potentially overwhelming the system's capacity to critical behavioral responses such as crying or grasping for air. Since the nervous system in the young infants is still developing, their ability to wake up shifts position or respond to distressor signals during sleep in the developmental stage. The combination of underdeveloped nervous system and the immune responses places that infant at higher risk. Goldwater emphasizes how genetic predispositions such as vulnerabilities to bacterial infections plays a significant role in SIDS. When combined with environmental stressors, infants genetically susceptible to bacterial toxins, particularly from pathogens like Staphylococcus aureus, may experience impaired neurobiological responses, especially in sleep-related circumstances. When these genetic vulnerabilities are compounded by prone sleeping, a known risk in SIDS, the infant's ability to respond to environmental challenges such as an increased heat or oxygen deprivation becomes compromised. The prone sleeping position increases the likelihood of airway obstructions, reduces the body's ability to regulate, exacerbating the impact of bacterial toxins and preventing the infant from waking up or adjusting their position in response to stress. Riggins and Associates further explore how social, and environmental stressors include exposure to cigarette smoke, interact with genetic predispositions to heighten the risk of SIDS. Infants exposed to cigarette smokes, whether during pregnancy or in postnatal environments, showed impaired respiratory responses and reduced arousal capabilities, particularly when combined with genetic factors that already place them at risk. These environmental factors disrupt the infant's neurobiological pathways, making reacting appropriately to stressors like overheating or being placed in unsafe sleep positions more difficult. Yang and Associates add to this understanding by highlighting the role of genetic mutations identified through molecular autopsy studies. In their research, they discovered mutations linked to heart and respiratory functions, which further predispose infants to life-threatening during sleep. When these genetic are combined with environmental, such as prone sleeping to exposure to sleep, they create a perfect storm, limiting the infant's ability to arouse or breathe effectively during stressful situations. This complex interplay of genetics and environmental triggers underscores the multifactorial nature of SIDS, where both intrinsic vulnerabilities and external conditions converge to impair the vital responses like waking or grasping for air. Udin and colleagues reported a rare case of neonatal hypomagnesemia with secondary hypocalcemia resulting from a new homogeneous mutation in the TRPM6 gene, which is crucial for magnesium absorption. The affected infant, a 26-day-old male, experienced severe episodes of apnea, cyanosis, and nasal bleeding, prompting emergency intervention. Despite the uneventful birth history, laboratory tests revealed critically low magnesium and calcium levels, corrected with supplementation. The identification of the novel TRPM6 mutation through whole exome sequencing provides vulnerable insight into the cause of infant severe symptoms and linked the case to an underlying genetic condition. This case is significant not only because of the newly identified gene mutation, but also due to the family's history of SIDS and chronic hypomagnesemia in a sibling, suggesting an autosomal recessive inheritance pattern. The study emphasized the importance of early detection and treatment of hypomagnesemia in neonates, as the condition can lead to life-threatening events if left untreated. Udin and colleagues also underscores the broader implications of this case for understanding the genetic factors contributing to SIDS, stressing the need for genetic screening in similar cases to prevent fatal outcomes. In a study by Fine, video analysis of toddlers who experience convulsive events sheds light on the disruption of sleep-wake cycles, which may have implications for infants at risk for sudden, unexplained death. The research involved continuous video monitoring of children's final moments, revealing that abnormal breathing patterns and a lack of arousal responses consistently followed convulsive events, lasting between 8 to 50 seconds. These findings suggest that similar mechanisms may be present in infants when disruption in the normal sleep-wake cycle impair the ability to wake up or respond to distressing situations. Again, oxygen deprivation and elevated carbon dioxide levels during sleep. The video observation research establishes a link between toddlers' seizure-like activity and the arousal deficits observed in SIDS cases. These convulsive events hinder the typical behavior response, such as waking up, gasping for air, or changing positions, which are crucial for survival when an infant faces a life-threatening situation during sleep. The absence of arousal, a critical protective mechanism, underscores the role of neurological dysfunction in regulating the sleep-wake cycle, underscoring the importance of understanding how similar patterns of infant disruption could contribute to SIDS. The study conducted by Bell and colleagues underscores the value of collaboration and education initiatives in preventing SIDS through outreach programs. Their intervention, Eyes on the Baby, aimed at training healthcare, social care, and community workers, successfully heightened awareness and knowledge of SIDS prevention measures. By addressing modifiable risk factors and promoting safe sleeping practices, this program equips a broad workforce to educate vulnerable families. The study also revealed a significant improvement in participants' confidence in discussing SIDS prevention, emphasizing the importance of continued investment in community-based education efforts, targeting families at highest risk of SIDS. Similarly, Fraga and colleagues highlighted the significance of prenatal education in preventing SIDS. Their focus on educating pregnant women about safe sleep practices resulted in a notable increase in knowledge among participants. However, the challenge lies in translating this knowledge into consistent behavior post-birth, underscoring the need for ongoing support and follow-up programs to reinforce safe practices after childbirth. The combined research emphasizes the intricacies of SIDS and stresses the importance of a comprehensive approach to prevention. Genetic susceptibilities, neurobiological irregularities, and environmental stressors all have significant roles and influence an infant's ability to respond to life-threatening situations during sleep. Studies indicate that outreach programs such as those investigated by Bell and Fraga are crucial in addressing these risk factors through education and community involvement. By providing healthcare workers, social service providers, and parents with knowledge about safe sleep practices and modifiable risk factors, these programs could substantially decrease the risk of SIDS. Ongoing efforts in early detection, education, and follow-up support are essential in lessening the impact of SIDS and enhancing outcomes for vulnerable infants and their families.